to your health during Women's Health Month here. We're addressing a common complaint that women share, and that is about pelvic pain, which can be the source of not only discomfort, but a lower quality of life overall. Dr. Megan Sneed, OBGYN with Lee Summit Medical Center, is here to discuss one of the most common causes of that pain. Dr. Sneed, thank you so much for stopping by. So pelvic pain can have a whole number of reasons, right?
Sure, it can. Absolutely. I would say I classify pelvic pain into about 3 different categories. About a third of the time it's your bowels or your gastrointestinal system. About a third of the time it can be related to your bladder or your urinary system. And about a third of the time it is from your female organs.
Okay, so let's zero in on one particular problem, and that is endometriosis. That's what we're here to talk about today. I've heard the word before. I've heard of friends saying they have it. What is it really?
Endometriosis is a condition where you have cells that grow like the cells that are inside of your uterus that bleed every month with your period, but they're outside of the uterus. They can be on the lining of your abdominal cavity, in your pelvis. They can be deep within the muscles around nerves. They can be in the ovaries. It can be in a lot of different places, but it's outside the uterus. And so it is hormonally active just like the cells inside the uterus. So every month it bleeds too, but it doesn't have anywhere to go. And so it stays in the pelvis and causes a tremendous amount of scarring in some patients.
And pain.
Absolutely. That scarring can cause pain, it can cause infertility, it can cause a plethora of symptoms, and often can cause GI symptoms that can delay the diagnosis because it can pretend to be something else for a while.
Yeah, it kind of masks itself.
Absolutely.
Okay, so how common is that?
Well, the most recent estimates are that there are about 11 million women in the United States with endometriosis. I'm sorry, 11% of the female population has endometriosis, which translates into over 6.5 million patients.
Okay, so this is quite common.
Absolutely.
Okay, ultimately then, how do we know we have it? How is it diagnosed?
Well, there is no perfect test for the diagnosis of endometriosis. Historically, laparoscopy was the gold standard, but we're tending to move away from that a little bit because when we look at diagnosing endometriosis, the first thing we look at is the symptoms of endometriosis.
Which are what? What do we notice?
Well, patients come in with pain, but it's not just menstrual cramps. Menstrual cramps are very common in women with endometriosis, but it's really a hallmark is that non-menstrual pelvic pain. So pain outside of your periods, pain when you have a bowel movement, pain during intercourse, it's deep pain, sometimes pain in your low back or pain in your legs. So that non-menstrual pelvic pain is what really clues us into that it might not just be period cramps.
That's when you say, aha, let's figure this one out. Okay, so once you have determined you have endometriosis, what can be done? Please tell me there's something that can be done for this.
Well, some women can have a tremendous amount of endometriosis and not really know it or have very many symptoms. And some women can have horrific symptoms or debilitating pain, and we don't really see a lot on laparoscopy. So it's best to go off of symptoms. There are medical treatments that we can use, and there are newer medical treatments that are much less difficult and much easier to take than the older ones are. And some patients do require surgery for treatment.
Okay, is it an intense surgery, invasive?
It can be. Endometriosis surgery, because of the unpredictability of what you will see, is kind of nerve-wracking for us as surgeons because we never know what we'll see until we get in there. So sometimes by the patient's pain, you expect a lot, and we don't see much. And sometimes you don't expect much, and you have a devastating case that it requires a lot of surgical intervention for.
Sounds frustrating from both sides.
It can be.
Thank you so much for
You're
stopping
welcome.
by. Important topic. For more from HCA Midwest Health, go to kctv5.com/HCA Midwest.